Hi everyone, my name's Janine. Thank you for joining me on my YouTube channel. So today I'm going to be talking to you about birth trauma and how it affects mothers and babies and how they're linked to things like soul fragmentation, anxiety, all sorts of mental health issues later in life, and autistic spectrum disorders, dyspraxia, dyslexia, all kinds of stuff relating to birth trauma. So first of all, let's talk about the initial birth itself. So most of us go into hospital, and that's where we have our babies, most of us in general. And we're giving birth lying on our backs when we should be in a squatting position where gravity can help us, and the baby is coming out faster, obviously because of gravity, and is born into the mother's hands straight away. So the first touch of a human they get is their mother's hands, and not some strangers that may be stressed because they've got a few other people they're dealing with and they've been rushing around and so on and so forth. And baby comes into the world and is taken off and not given straight to the mother for various reasons as well. All of these things affect the baby and the mother and the connection between the mother and child. If there has been forceps used, they can obviously affect the baby, the shape of the head of the baby. That normally turns in, it does go back to normal, but it's very traumatic for a mother because it's quite a scary situation to be in. And the pain aspect of it, because of poor nutrition, and this is across the board, we haven't got the nutrients in our body that were put there by our creator to help us give birth naturally, and with natural painkillers in the body. And even the physicality of the body has changed so much because of the density due to the food and everything else that we consume, whether that's alcohol or cigarettes or toxic chemicals from pesticides and things like that. All of these things affect mother and child, but they affect the way that we give birth because of the lack of natural painkillers in the system. So what happens? Well, generally we'll be offered gas and air or something similar to that, and epidurals and things like that. But the epidural, what that does is basically paralyzes you, and it's very difficult to push and give birth when you can't feel what's going on in your lower body. It may stop the contraction pain, but it's stopping us feeling what we're doing. So we've got the trauma of the fear of it, because especially if it's a first child, we've got the anxiety, the being in the wrong position giving birth. We've got the pain aspect, which is traumatic for the body. And we've also got what the epidural does, which is giving a massive dose of painkillers to an unborn child in the womb or in the birth canal even. So there's an overdose thing going on there that not really, I don't think people are talking about. And I've looked online and it says there's no damage to the baby at all, but that doesn't make common sense to me. There has to be an effect. If you're putting a drug into a pregnant woman's body, it's got to have an effect on the child that's in there. That to me is common sense. So there's all of these things going on. When we're in that much pain and the trauma of it, and then we may need to have an episiotomy, and that's where, we're cut and we end up having stitches, which is also scary, and can be very painful during and after the birth, for weeks after, while we're healing. All of this stuff is going on, and eventually the baby comes into the world, and most women say they forget about this stuff. But I looked online, and the NIH say that 45% of women have birth trauma. Well, if that's the statistics coming up, that's women that have been honest enough to speak up and fill the questionnaires in and so on and so forth. But I'd be very intrigued for all of you ladies out there that may have had children, whether you've had one or whether you've had 10, and the difference in how that affected you. Certainly for, when you first came home from hospital, but later into your life as well. If the trauma, there was even more trauma, maybe the baby was in distress or something like that happened, if you feel that that has actually gone from your system or was ever dealt with at all, I would be intrigued in the comments below if you want to give some feedback about your experiences, because 45% birth trauma, they're talking about big traumas that go wrong. I'm talking about normal giving birth that is traumatic to women and children and the fathers in many cases as well, watching their partner suffering that much pain and stress can lead to trauma by proxy. I wrote an article about this a while back. There's lots of articles on the blog on my website if you want to go and read some of the stuff that I've been writing about there, particularly, linked into anything to do with trauma. So I believe that the figure 45% is a lot lower than it actually is, because I don't think they're taking into consideration. Maybe women should be filling in a questionnaire a month or 3 months or 6 months after they've given birth to see how they're feeling, or even 5 years later and see if it, 10 years later, is it still affecting them? Do they still feel broken by it? And they can be, because when we're in a situation like that, we can soul fragment. And what that means is